All right, guys, welcome back to Underground Science. In this video, we're going to be talking about X-linked agammaglobulinemia, or also called Bruton's agammaglobulinemia. Okay, so before we get started, um, let's talk about our B cells, right, and how they're developed in the bone marrow. Normally, right, as we know, we have our hematopoietic stem cell, and that can differentiate into a pro-B cell, right, in our bone marrow, pro-B cell, and the pro-B cell can then turn into a pre-B cell, right? And then the pre-B cell can eventually turn into a naive B cell, right? So eventually the pre-B cell can turn into a naive B cell. And then of course that can turn into a plasma cell, right? Once it gets activated and whatnot. So let's talk about this step right here. Okay. In order for you to have a conversion from pro B cell to pre B cell, in order for that to happen, you need Bruton tyrosine kinase. Okay. So in order for that to happen, you need Bruton tyrosine kinase. Let's go and write that down. So in order for this step to happen, right, you need functional Bruton tyrosine kinase. It turns out, though, in X-linked agammaglobulinemia, you have a mutation in the BTK gene that codes for Bruton tyrosine kinase, right? So then if you don't have functional Bruton tyrosine kinase, you can't go from a pro B cell to pre B cell. Therefore, you can never make naive B cells. If you can't make naive B cells, you can't make plasma cells and you can't make any antibodies. That's why it's called X-linked A gamma globulinemia. So it leads to no antibody production. Okay, so let's go and see what we have next. So again, we have a mutation in the Bruton tyrosine kinase gene. That means you don't have functional Bruton tyrosine kinase, and you can't get proper B cell development like we saw. You cannot get conversion from a pro B cell to a pre B cell. Therefore, you cannot make a naive B cells. Therefore, no plasma cells. Therefore, no antibodies. So you don't have any mature B cells. Therefore, no plasma cells, no antibodies, which means no humoral immunity, right? Which means you're going to be really susceptible to certain infections. Let's see what those infections are. Okay, so as we said, because you're not producing any antibodies, you're at high risk for recurrent infections beginning around at the 6 months of age, beginning at around 6 months of age. Why? Because in breast milk, remember, you have maternal IgG, okay, to protect you. But afterwards, you're at increased risk of recurrent infections. Now, what are those infections? Remember, we talked about this in our previous videos. Immunoglobulins are important for opsonization. It's important for binding onto pathogens so that your complement system can come in, right? And certain macrophages and neutrophils, right, can come in and destroy whatever pathogen the immunoglobulin is bound to. So it's important for opsonization and getting rid of certain bacteria, especially encapsulated bacteria. You need immunoglobulins to bind onto encapsulated bacteria so that your immune system can come and take it away and destroy it. Okay? But the problem is in this, right, you don't have any immunoglobulin production due to the Bruton tyrosine kinase gene mutation. So if you don't have any antibodies, right, you have an increased chance of infection for encapsulated bacteria. Because remember, your complement system alone can't destroy it because C3b has a hard time binding onto encapsulated bacteria. So you need antibodies. But if you don't have any, then you're going to have an increased chance of infection of encapsulated bacteria like strep, strep pneumo, Haemophilus influenza, and Pseudomonas, and bacteria like that, right, that have a capsule around them. All right, so we can even add that in. So we would also increase risk of Pseudomonas infections, like Pseudomonas aeruginosa. All right, and of course you could also see. So this is because of we can actually divide this up. So if you don't have immunoglobulins, what types, right? So that would mean you don't have any IgG, right? And IgG is really important for opsonization. So you increase the risk of encapsulated bacteria infections like Pseudomonas, strep pneumo, and Haemophilus influenza. Then, right, what other antibodies are there? You don't have IgA. Okay, so what can IgA do? That increases your risk of mucosal infections, right? So mucosal infections, especially in your GI tract. So what would those be? That would be Giardia lamblia, which is a parasite, right? And certain enteroviruses. Now, certain examples of these enteroviruses are we can have an echovirus infection, we can have a Coxsackie virus infection, we can have a poliovirus infection, right? And we know that echoviruses can lead to meningitis. We know that Coxsackie virus can lead to myocarditis, cause inflammation of your heart muscle. And poliovirus, we know, can infect your anterior gray horn, anterior motor neurons, right? In your anterior gray horn, your alpha motor, the nuclei of your alpha motor neurons, which can lead to lower motor neuron symptoms like flaccid paralysis, for example, and hypotonia and hyporeflexia. So this can lead to paralysis. That's why, because the polio vaccine is actually a live virus, this is contraindicated in people who have X-linked agammaglobulinemia. So it's contraindicated in these patients because it's a live vaccine. Okay. So these are certain viruses that can infect people or patients with X-linked agammaglobulinemia because of no IgA. So you don't have any mucosal, you have no defense in your mucosa, right? You don't have any we know IgA is important for mucosal immunity. So you don't have any IgA, then you're going to get mucosal infections, for example, enteroviruses. And IgA is also important in your GI tract, as we discussed, right? And a pathogen that can take advantage of low IgA that can infect your GI tract, which is right here, Giardia lamblia. Okay. So basically, if you can get these patients can get recurrent pneumonia, recurrent sinus infections, right? Due to encapsulated bacteria, have viral meningitis, as we discussed, due to echovirus, for example, chronic diarrhea, right? Maybe due to giardia. So that's basically it. That's the main things I want to talk about for X-linked agammaglobulinemia. Of course, if you tested their immunoglobulin levels, you would see that they had low IgG, they would have low IgA, low IgM, right? All the antibodies, low IgE. So they don't have mature maturation of their B cells, proper maturation. Because remember, they can't convert their pro B cells to pre B cells, so they can't create naive B cells, therefore no plasma cells, no antibodies. And of course, um, if you, if we talked about the lymphoid tissue, right, like your lymph nodes and tonsils, lymphoid tissue is part of those, right? And if you don't have mature B cells, no antibodies, then of course you can expect to see small or absent tonsils and lymph nodes. Okay, so that's another thing to keep in mind. And that's basically it, right? So remember to avoid live vaccines, like for example, like polio, like we just talked about, because you can't create antibodies, right? So avoid polio vaccine, which is a live vaccine. That's why you should avoid it. Also, the MMR vaccine, right? Measles, mumps, rubella, and varicella. Okay. So these are live vaccines, so you should avoid these because these patients with X-linked agammaglobulinemia can't make antibodies. Okay. And you need functional B cells to make antibodies. So if you don't have functional B cells, you can't make antibodies against these vaccines. Okay. So avoid polio, MMR, and varicella and live vaccines in general. And that's basically it. I hope this video made a little bit of sense. I hope it wasn't too confusing. Thank you guys for watching and see you guys in my future videos.